Right. Everyone ready? Yeah, I just quickly sort something out. All right, ready to go? Excellent. Welcome everyone to the Murrumbidgee Local Health District COVID-19 update. So the reason why we asked to meet with you today is to give some feedback regards to the possible exposure in Temora. So you would be aware that there was some exposures on the 16th and 17th of August 2021, and in response to that, Murrumbidgee Local Health District stood up a testing clinic, and there were 320 tests done at Temora Town Hall yesterday, 90 at the Beckham BP Roadhouse, 43 at West Wyalong. And in addition to that, there were 260 people tested at our drive-through testing facility at Equix. Now, the good news, the information that I've just received is that all the swabs that have been processed so far from Temora have all come through as negative. So that's obviously great news for the community. But what we need to remember is that the incubation period for this illness can be up to 14 days. So really, we still have to be extremely careful in the meantime, because that 14 days will only expire on the 31st of August. The other important factors to remember is that the Delta variant is out there, and you have to assume that either you have it or someone else has it, because the problem is people are infectious when they're asymptomatic. So people are trying to do the right thing. They don't know that they're unwell, but they are willingly transmitting the illness to family members and friends and other members of the community. So it's absolutely essential that we maintain all the measures we have in place, the social distancing, mask wearing, hand hygiene, following the public health orders to make sure that we keep one another safe while we ramp up vaccination. I cannot stress it enough. I do not want to come and stand here and have a press conference about a 30-year-old otherwise well person who's died because of COVID because they were not vaccinated. It really is essential that we get vaccinated. If we look at the patients who passed away recently in Sydney, the ICU admissions, they are all people that are either completely unvaccinated or they're only partially vaccinated. So in terms of AstraZeneca, the advice has now changed. If you've had your first dose of AstraZeneca more than 4 weeks ago, you can actually go to your GP or come to the vaccination clinic to get your second dose, because we need both doses to protect us for either vaccines. And you also need to remember that you'll only be protected about 12 days after your vaccination. So you'll only be fully protected 12 days after your second vaccination. So any questions for me at this stage?
Just in terms of that essential worker, the one who did pass through those regions,
Yes.
A lot of people are asking why it took that week period to actually get those results. Can you explain what happened during that week in terms of contact tracing or how that case actually came to be identified?
So depending on where you live, there's different testing requirements. So the people in the hotspots in Sydney actually have to get surveillance testing every 3 days. So if we have a staff member that comes from there, even when they're with us, they have to do their surveillance testing every 3 days. For other areas, it would be weekly, and my assumption is that that test would have been a weekly asymptomatic test. Now, when people have surveillance testing, they are not required to isolate while they're waiting the test result, and then it can really depend on where the test is being processed for how long it takes for the result to come back. And then once again, you can appreciate that the public health units in New South Wales are extremely busy, and it can take some time. And that is why all those other measures that I've discussed before are so important, because if we practice hand hygiene, wear our mask, limit interaction with our other individuals, it reduces our risk significantly. So, and that is probably why we've had such a good outcome up till now. However, if you are required to have a COVID swab because you're symptomatic, in other words, you're unwell, then you need to isolate until you have the result back And it's probably not a good idea to go and interact with other people, even if you don't have COVID, but another viral illness. If you're identified as a close contact, then you are required to have a test, but isolate for 14 days irrespective of the result of the test. It is unfortunate that you hear stories of individuals who've been close contacts, who present for medical appointments, for instance, without warning the practice beforehand. So it really is important that if you've been told to isolate because of a public health order and you need to seek health care, and you should seek health care if required, just give the practice a call and say you're coming in to make sure that we can keep you safe and also, keep the other patients safe.
And a couple of counts from the Murrumbidgee were mentioned in the press conference today, just in regards to vaccination rates because they've been so high. Could you just touch on that and how you think the vaccination rates are going in the area?
Well, I will pass that question on to Emma Field, who manages our vaccination rollout, but I can assure you that in Murrumbidgee so far we've done 31,761 vaccines or vaccinations at our Murrumbidgee clinics, but Emma can give you an update on those numbers. But we want to thank the community for coming out. There is vaccine available, either Pfizer or AstraZeneca, depending on your age. If you've had your first dose of AstraZeneca, if it's more than 4 weeks, come and have your second dose with us. But I'll, ask Emma to comment and give you an update on our vaccination rollout.
I've got a question.
Sure.
You mentioned that the Timor results have come back negative so far.
Yes.
What day is that result from? Does that include that huge testing that we saw, 450 across Beckham, West Island and Timor yesterday? Is that what you're talking about from that negative?
Yes, it would include some of those results, but some of those swabs may still be in the system being processed, but the ones that have been processed from those clinics that we've tested have all come negative so far. But we will give you an update once we've processed all the tests from those clinics. But it is important for people to stay vigilant. If you have the mildest of mild symptoms, please come and have a test, because we can still have people become symptomatic up to next week, and some people may have very mild symptoms. So it's very important to, if you feel unwell in any way, please come and have your COVID test.
Well, then you're still encouraging people to come forward for just in case tests, i.e. if someone's been in tomorrow, they haven't been to any of those exposure sites and they don't have symptoms, should they be coming forward for a test, or is that clogging the system? What's the advice on that?
The advice, if you've been in Timor during those times of exposure, you must have a test done. Otherwise, you can have a test. If you're concerned, it's probably better to test than not to. And the reason why that advice has changed is because we have a current outbreak in New South Wales. I would rather have one too many negative tests than miss one positive test, because Delta is so infectious that one individual can infect up to 5 before they even become symptomatic. So rather, if you're anywhere unsure, come and have a test, because there's so many opportunities to get tested now, and we have more than sufficient capacity in Murrumbidgee to handle the testing that's currently underway.
And just on the back of that as well, in terms of surveillance testing, just in general, those that aren't government mandated, is that something that's being encouraged as well, or is that something that's not being encouraged, I suppose, going forward?
So what we do is we follow the guidelines from New South Wales Health, but very interesting, we obviously have staff that transport patients across borders, and what we implemented yesterday, actually at the request of that service, is that their staff will have weekly surveillance testing, but the rest of surveillance testing here is really just in line with what New South Wales Health requires.
Yeah, I was going to say, with the situation in Timor, I know when you go to Morgan for testing, are there any permanent solutions for testing clinics?
The patients can be tested in Timor, so obviously if we have an outbreak, the patients can be tested with our mobile testing clinics. Patients can obviously still have a test with their local GP. They can have a test, at the hospital as well if they're unwell. So it should not be a problem for someone to access a test. The benefit of the mobile testing clinics is we can respond to an area where we need, very quick high testing rates. So that is why we utilize the mobile testing clinics, and that will continue as long as it's required.
In terms of those mobile testing clinics that were deployed, are they packing up today, or are they staying a few more days, or what will happen with those?
What we'll do is we'll probably give Emma, should be able to tell you because she's
Done so well. Can
in
I-
charge of the clinics, but what I'll do,
Whenever you like.
I'll hand over to Emma, and she'll be able to give you the
Yeah.
information about the vaccination and the mobile testing clinics.
Yeah.
All right.
Okay. So just what was that question again?
So just in terms of those mobile testing clinics that were deployed to Temora and Beckham, will they remain for the next few days, or are they packing up today, or what's
Yeah.
going on there?
So we do plan to pack those up today, the mobile clinics in Beckham and Area Park. As Len explained, the model that we have, rather than having permanent testing sites, we have this mobile testing plan, and that's how it works. So as soon as we get any type of increased need for testing, we go out and we deploy testing into that area. So obviously we did a high number of tests yesterday in Beckham and today in Area Park, and certainly we're there in Temora today as well. And we'll just monitor that today and see how that goes. Nothing is a barrier in terms of being able to put more testing out there. We just wait to see what the need is.
Just want to add something.
Yeah.
So a few towns in Murrumbidgee were mentioned in the press conference for having very high vaccination
Yeah.
rates in the past week. Could you just share your thoughts on that too?
Sure. So we do have very good vaccination rates in some of those areas in Murrumbidgee. Certainly we've got good access in Murrumbidgee as well, for both across our Murrumbidgee Local Health District vaccine clinics, but also with our GPs. They've also got a number of clinics across the district that are offering both Pfizer and AstraZeneca. I think, certainly we've seen an increase in the uptake of vaccine the last 2 weeks, and that's pleasing to see. However, we did have good rates of vaccine prior to that as well. So, but certainly an increase in the last 2 weeks. Yep. Good. Yep.
My last question was mandating vaccines. Will LMHD be able to get its staff vaccinated by the 30th of September?
Yep. So we've got very high rates of vaccination uptake with our staff. It's very pleasing, to be honest. That's something that we're very proud of, in that staff have come forward to get vaccinated. We certainly are aware of our requirement by that date, and we're working towards that. So yes.
When you say you've had high uptake, what is that uptake?
Yeah, so well over 70% of our staff have been vaccinated. So that's a really good uptake of staff vaccine. And so we are working towards meeting that goal. So.
What's the rate amongst those staff working in aged care and the NPS systems that NLHD runs? Do you have any figures about
No,
that?
I don't have them on me, sorry. I can't comment on that. Yep.
And the Nurses and Midwives Association did express some concern earlier in the week that small rural communities would be affected if staff from hospitals, even if one or two, weren't able to be vaccinated in time. Are you confident that NLHD will be able to vaccinate all its staff by the 30th of September?
Yeah, we are. We've got some really good, robust vaccination models, and certainly we've been out, as you probably know, earlier in the year, March, April, May, and we can go out again, and we do go out. We've got a number of hubs and outreach clinics, so we work with our partner clinics as well, like our GPs, to also ensure that they have access. So yes, we absolutely have access for all our staff to receive vaccination.
And just in regards to lockdown, obviously another 2-week extension was given out today. Do you just have any messages for people who may be a bit over it, then we don't have any cases in the area? So just what are your messages to people who have to go through it for a couple more weeks?
Yeah, certainly, it is a very anxiety-provoking time for a lot of people, and it can be quite stressful. I think, really reach out to, family members for support. And also just remember we do have this on our doorstep, this outbreak. and it's really important that people do comply with those lockdown orders. We've seen in the last couple of weeks how the lockdown has impacted in terms of spread, and I think that's really important to observe and certainly, comply with all of the lockdown requirements, including mask wearing.
And a lot of people, it's kind of a mixed response if we should stay in lockdown or not. Just what are your thoughts on that? Like I said, there's no cases here. There has been exposure sites, but yeah, what do you think about it all?
I mean, I think we certainly need to comply with the lockdown. That's it. Bottom line is that we need to comply with the lockdown orders. I'm very confident in the state's position on this, and I think that what's currently happening is very proactive, and I think that certainly we are in this space, and it is what it is, and I think we just all need to do as much as we can to throw at this pandemic.
Emma, I'm happy to just in terms of the lockdown. The lockdown now is different from the lockdown before because we have vaccination. The reason why we are in lockdown now is to protect us, to allow us to get vaccination rates up. We are not powerless against COVID, we just need a little bit more time. So we know that it impacts people. I have 3 young children, and I can see they miss their friends, they miss that interaction. But really the schools have been absolutely brilliant using technology to interact with children. But we know why we're in lockdown. We're protecting ourselves so that we can get vaccinated. And it's far better to be in lockdown with no cases and get vaccination rates up than to be in lockdown because we have patients with COVID and young people dying in intensive care because they've not been vaccinated. I cannot stress it enough. Go out and get vaccinated for yourself, for your family, or for your friends. And that is really the only way for us out of the lockdown.